Take a moment to feel your spine. If you really focus, I bet you could feel each of your 24 vertebrae. If you have all 24, it is considered anatomically correct. But what if I told you you could actually only have 23 vertebrae? Would you believe me? Lumbosacral transitional vertebrae can be referred to as LSTV or Bertolotti syndrome. 2 months ago, I was diagnosed with Bertolotti syndrome, and I've been so fascinated to discover that missing a vertebrae is the answer to my chronic lower back pain. Today, I hope you can become familiar with Bertolotti syndrome, how it occurs, the symptoms, and the treatment options. Let's first go through a quick anatomy lesson to better understand what Bertolotti syndrome is and how it occurs. Essentially, Bertolotti syndrome is where you only have 4 lumbar vertebrae where you're supposed to have 5. The Virginia Spine Institute sums up Bertolotti syndrome stating that the lowest lumbar vertebrae couldn't decide if it wanted to be the spine or the sacrum. As I mentioned before, in normal anatomy, there are 24 vertebrae in total. There are 7 cervical vertebrae at the top, 12 thoracic vertebrae in the middle, and 5 lumbar vertebrae at the bottom. According to an article published by Mayfield Clinic, the lumbar section is responsible for holding your body weight. Bertolotti syndrome is not something you catch like the flu. You're actually born with this syndrome. The fusion of the 5th lumbar vertebrae and the sacrum, which is what Bertolotti syndrome is, happens when your spine is forming during the 8th week of pregnancy. If you take a look at this skeleton, the fusion happens at the last lumbar vertebrae and the sacrum. The Embryo Project Encyclopedia provides information on the science of embryos, development, and reproduction. According to Corinne DeRuiter, transitional vertebrae does occur while the embryo is forming the spine. This process is called embryogenesis and is an incredibly intricate process. The spine is complex and each vertebrae is individually formed during this process, which is why numerous abnormalities can occur. Bertolotti syndrome is just one of those abnormalities, which is why there isn't a true answer to exactly how it occurs. Bertolotti syndrome is not particularly rare, but it can go unnoticed for some time, and each case is different regarding the symptoms and treatment, including mine. Observing case studies is the best way to gather insight on the symptoms each patient encounters, as they are diagnosed with Bertolotti syndrome. I'll start by sharing a little bit about my experience and how I came to find the answer to my lower back pain. I've always had lower back pain and terrible posture, which are the first symptoms of Bertolotti syndrome. I have always attributed this lower back pain to the stress I put on my back with sports. It wasn't until the beginning of this year when I stopped being as active that the pain became unbearable. I went to multiple doctors before finally being diagnosed with Bertolotti syndrome. The fusion showed up on a CT scan. The reason I wasn't diagnosed before is because regular lower back pain is so common. Bertolotti syndrome doesn't immediately come to mind. After the initial diagnosis, I didn't get many answers. The treatment options were just pain management, physical therapy, anti-inflammatories, and to stay active. But they ultimately said this could be bothersome for the rest of my life. The syndrome goes unnoticed because pain usually isn't involved. The place where the vertebrae is fused must be sitting just right to cause this amount of pain, but this is the part that is rare. An article published by Oxford Academic Journals explains this concept in the abstract of the case study, stating that Bertolotti syndrome is underdiagnosed because pain is rarely associated with this syndrome, thus not drawing attention to the abnormality. A contrasting case study is published in the Journal of Orthopedic Case Reports and is categorized as rare. The patient was a 62-year-old female with a clinical exam showing lower back pain relating to the nerves surrounding L5. She had complete sacralization of L5 vertebrae, meaning the vertebrae was completely attached to the sacrum. The treatment prescribed to her was just pain management as well. She was prescribed anti-inflammatory drugs, sent to physical therapy. As she came back to her follow-up appointment, she reported that she had no pain, but this was due to the nerve being completely pinched after therapy, resulting in numbness of the lower back. In conclusion, the doctors realized there was no treatment in her case. This case study was reported, and although Bertolotti syndrome is a congenital disease, it can still cause symptoms in the elderly, and they can go unnoticed for some time. The last case study I chose to observe is one found in the International Journal of Spine Surgery. This study focused on multiple cases and how Bertolotti syndrome affects the lives of patients and the biomechanics of the body. The study observes that each case is different and each depends on multiple factors. Unlike other cases, this article mentions surgery as a possible treatment option, But with possible being the key word, it was concluded that this is not an ideal option. This article concludes stating, further studies with larger sample sizes and longer follow-up time would better demonstrate the effectiveness of surgical resection and help guide treatment. This statement alone helps me to understand that because lower back pain is rarely attributed to Bertolotti syndrome, this case study concludes vary, and there are not concrete answers. Today, I hope that you've learned something, even if it's just lumbosacral transitional vertebrae is just a really long word. Having 23 vertebrae is more than just an interesting fact or conversation starter. For me, it is an answer to the questions I've had for so long. I hope that next time you have unexplained back pain, you count your vertebrae twice.